Assalamu alaikum. Today the topic of our lecture is drugs for asthma. They are designed to reverse and prevent airway inflammation, and the goal of asthma therapy is to decrease the intensity and frequency of asthma symptoms and prevent further exacerbations. Classes of anti-asthmatic drugs include beta-2 adrenergic agonists, which contain short-acting beta-2 agonists, also known as SABAs, long-acting beta-2 agonists, also known as LABAs. The second class is corticosteroids. The alternative drugs used to treat asthma include leukotriene modifiers, mast cell stabilizers, and monoclonal antibodies. The first drug included in the classification is short-acting beta-2 agonists. They have rapid onset of action around 5 to 30 minutes and they provide relief for around 4 to 6 hours. The drugs included in this class are albuterol and levalbuterol. The mechanism of action is that it causes the bronchodilation of bronchial smooth muscles. Adverse effects are tachycardia, tremors, dizziness, hyperglycemia, hypokalemia, hypomagnesemia. The tremors in this case, they can be minimized with inhaled delivery versus systemic administration. The next drug for asthma is LABA, also known as long-acting beta-2 agonists. They have a long duration of action, providing bronchodilation for at least 12 hours. They are the analogs of albuterol. The drugs included in LABA are formoterol and salmeterol. Their mechanism of action is similar to SABAs, that is, they cause bronchodilation of bronchial smooth muscles. Their adverse effects are also similar to SABAs, including tachycardia, tremors, and dizziness. Some black box warning for LABAs are that they are never used for acute exacerbations and they should never be given without inhaled corticosteroids. Now comes the alternative drugs used to treat asthma. They are used in patients who are poorly controlled by conventional therapy, and these drugs should be used in conjunction with inhaled corticosteroid therapy for most of the patients. The first class in this alternative drugs is of leukotriene receptor antagonists. It includes 3 drugs, montelukast, zafirillukast, and Xelutin, with different mechanism of actions. Montelukast and zafirillukast, they inhibit LTC4, D4, and E4, which are the cystinyl leukotrienes. What are cystinyl leukotrienes? They are the products of lipoxygenase pathway of arachidonic acid metabolism and part of inflammatory cascade. Xelutin, it inhibits LTB4. And what is LTB4? It's a potent chemoattractor for neutrophils and eosinophils. So when LTB4 is inhibited, no chemoattraction for neutrophils and eosinophils. The adverse effects of these drugs are headache and dyspepsia. The next class of drugs is mast cell stabilizers. It includes cromolyn sodium and ketolefin. Their mechanism of action is that they prevent release of inflammatory chemicals such as histamine from mast cells, the cells that are responsible for allergic response. Their adverse effects are cough, irritation, and unpleasant taste. The next class is monoclonal antibodies. The drugs included are omalizumab, mepolizumab, benralizumab, and restylizumab with different mechanism of actions. The mechanism of action of omalizumab is that it binds to IgE, decreasing its binding to its receptors on mast cells, which limits release of mediators of allergic response. The 3 of these drugs, their mechanism of action is that they act as IL-5, that is interleukin-5 antagonists. And what is interleukin-5? It is a cytokine which is involved in recruitment, activation, and survival of eosinophils. The adverse effects are anaphylactic reactions, arthralgias, fever, rash, and increased risk of infections. There are 2 additional drugs, theophylline, which has now been replaced with beta-2 agonists and corticosteroids due to its narrow therapeutic window, and cholinergic antagonists, which include 2 further drugs, ipratropium and tiotropium. Ipratropium is short-acting and it is useful in patients who are unable to tolerate SABA or in patients with asthma COPD overlap, but they are not recommended for the routine treatment of asthma as their onset is much slower than that of inhaled SABAs. Tiotropium, it is long-acting and it can be used as an add-on therapy in the treatment of patients with severe asthma. This was all for the drugs of asthma. For complete detail of asthma, you may visit my channel. Thank you so much.